Get on up.
Everybody right there.
Get into it.
Everybody right there.
Get involved.
Everybody just come on up. Come on up.
Partnership for the Public Good, or PPG, which unites 268 community organizations working to build a better Buffalo. We're delighted to be joining you from now on every Tuesday at 7 p.m. Today we're joined by friends from Roswell Park Cancer Institute. We have Alan Denizard, Emily Facio, and Ezra Scott, tobacco control specialists, and Ezra is project coordinator over there. We're going to be talking about the hazardous effects of tobacco in Erie County, and we'll be getting into some of the disparities that affect tobacco usage and health impacts from it, disparate impact on people in poverty, people with mental health issues, and talking about some of the policy solutions that can help us make progress, policies and programs that will target points of sale, issues like what age should people be able to buy tobacco at, all coming your way. Don't forget to follow PPG on Facebook and Twitter, and of course you can always get great information on our website, ppgbuffalo.org. The Public Good is sponsored in part by Univera Healthcare, real people who really care. Video of the show is on our Facebook page at facebook.com/ppgbuffalo. You can find videos from previous week's shows on our YouTube page. A couple of announcements for you. You're all invited to PPG's 10th anniversary celebration. It's this Thursday, October 5th at 6 p.m. at the Albright Knox Art Gallery. It's free and open to the public. It's going to be a very festive evening with beautiful music from Drea Denor, who just did The Spirit of Nina Simone. We're going to have breakdancing from the Differential Flavor Crew and poetry from Carl Dennis and Olga Carmen. I'll be giving a talk called One Nation Under a Groove, Beauty and Democracy Reconsidered. I'll be talking about the democratic beauty of Parliament Funkadelic. So all you P-Funk fans out there, you're going to want to check that out. So it's this Thursday, 6 p.m., Albright Knox Art Gallery, Beauty and Democracy, free and open to the public. Hope to see you there. More information about that on our website and our Facebook page. Also want to let you know that our friends at Open Buffalo are holding a Justice and Opportunity Essay Contest. If you had $2,500 to solve a problem that you see in your community, what would the problem be, and what would you do about it to create change? Essays can be submitted by email to info@openbuffalo.org, or you can mail them to Open Buffalo at 617 Main Street in Buffalo. All entries are due no later than October 10th, 2017, so get your pencils out and work on that essay contest, Justice and Opportunity Essay Contest at Open Buffalo. You can find out more about that on Open Buffalo's webpage or their social media as well. Well, with that, I want to welcome our friends from Roswell Park Cancer Institute here today. Ellen, Ezra, and Emily, thanks so much for being here.
Thanks for having us.
Yes, yes. Well, we want to talk about some of the harmful effects of tobacco, but in particular, we're going to zero in on some of the disparate impacts they have on populations that are already struggling with things like poverty and mental health. So tell us a little bit about how and why tobacco's impacts are felt unequally in our community.
Well, thank you, Sam. So what we do know is that the rate of tobacco use is going down across state and national levels. Here in New York State, we're looking at about a 14% smoking rate, which has gone down considerably. But we do know that the rate of smoking is still high among people who are in lower SES or living in poverty, people who are struggling with mental health and substance abuse disorders. And so our work is still cut out for us to make sure that they have access to treatment and have the facts of why the rates are still so high. So
the very people who are struggling with a lot of other health issues due to living in poverty and facing other kinds of discrimination in society are also being afflicted with tobacco addiction at an unequal rate.
Absolutely. So if you look at Erie County with a smoking rate of 18%, here in Buffalo, we're looking at a rate of 30%. People who are living in poverty smoke at an average of 26%. And so, yes, we still have a lot of work to do.
When you were telling me the statistics earlier, it was striking to me that the smoking rate in the city of Buffalo is pretty much exactly the same as the poverty rate, right about 30%. And that's no accident because, as you're saying, people in poverty smoke more. What are some of the reasons for that? Why is it that people in poverty are particularly vulnerable to tobacco?
So some of the reasons is that our tobacco companies are really good at marketing and targeting these populations. So they know that they can go out into neighborhoods that are lower income, and they're able to put up their advertisements, and so we have higher rates of points of sale. And Ezra can speak about that, but we do, so there's more, people can see it, it's more visible out in our communities. We also know that our population are folks who are suffering from mental health and substance abuse. They have access to the nicotine products and cigarettes, but they don't always have access to the resources to quit. And so that's one of the reasons why it's still so high.
Right. Ezra Scott, project coordinator, tell us a little bit about this phrase, points of sale. What does that mean in the context of tobacco?
Well, when you speak about the points of sale, you begin to think about how tobacco companies and retailers are advertising their tobacco products, the signage. You begin to think about the coupons that they send to you in the mail, intriguing you to want to purchase tobacco products. But also, points of sale, one of the things that I found that was very alarming, which I'm pretty sure that you may be aware of, you want to consider the population of Erie County. The population of Erie County is approximately 1.2 million residents in the county. There's approximately 900 total tobacco retailers in the county.
Yeah.
Now, the city of Buffalo, approximately 250,000 residents. So the question is, why is it that a quarter of the population has almost half of the amount of retailers in this one city?
That are selling tobacco?
Yes.
So we got about a quarter of the population here in the city of Buffalo, but we have about half of the retailers who are selling tobacco products.
Absolutely. So you approximately have about 900 retailers in Erie County, 400 retailers in the city of Buffalo. So again, that's what makes us the point of sale so alarming.
Yeah.
It's right there. It's in our faces.
Yeah.
And it's what's been very fortunate for us. The city of Buffalo has made tremendous progress. Just recently, they passed the Green Code, which is something that restricts tobacco retailers and also anyone that intends to sell alcohol.
Yeah, so the Green Code, we talked about it on this show, thinking about different zoning and housing development issues that came up as the city revised its land use policies, did the huge rewrite of all of those. We never thought about it from the point of view of tobacco, so tell us, what did the Green Code have to do with tobacco?
Well, what it does is, again, with point of sale, it prohibits and it restricts new individuals that look to sell tobacco and alcohol products from opening up in certain specific areas. And that's a wonderful big help.
Yeah.
We have another policy that we are beginning to educate the communities about, T21, which is Tobacco 21. And the reason why that's so significant is because you'll find that there's a high density of tobacco retailers that's located near schools.
Near schools.
Yes. And
that's not a coincidence?
It's not a coincidence at all, because what you'll also find is that 90% of smokers usually start before the age of 18. So, of course, you want to catch them while they're young, so now you can have customers.
Right. And, of course, people's brains are not fully developed before they're 18, and the research shows that things like impulse control in particular are not fully developed, so people under 18 are especially easy marks for products like tobacco. And of course you're trying to impress your friends and do something that's a little dangerous or forbidden or whatnot, and so you end up trying things like cigarettes. So Tobacco 21 would restrict, would make it illegal to sell tobacco to people under 21, whereas the current age is 18. Is that right?
Absolutely. And the reason why that is significant is because if you have an individual that's 18, usually they're hanging out with young men and young women who are 15, 16-year-olds. It's likely to have that connection.
Right.
But if you prohibit it to the age of 21, and now it's less likely to have a 21-year-old hanging out with a 15, 16-year-old, which is now, it decreases the chances for that individual that teenager to begin smoking.
So it's really a ripple effect. We're not just protecting the kids who are 18, 19, 20, but we're also protecting the younger kids who are going to tend to be hanging out with the kids in that age group.
Absolutely.
So is that something that has happened in other parts of New York State?
Absolutely. You have Chautauqua County and Cattaraugus County that have passed this new law and initiative. And now we're beginning to educate the communities here in Western New York. So hopefully we'll be seeing that very soon.
Yeah.
We're excited about it.
Now, I don't know if you all end up having this conversation, but for folks out there who are not smokers, who aren't using tobacco themselves, why should they care about limiting tobacco use among, their fellow residents in the county? Why is it better for all of us, I guess, if we are able to decrease smoking rates, even those of us who don't smoke?
Well, the reason why you'd want to decrease it is for many reasons. It has a huge health burden. So you're talking about people who are smoking, they have chronic diseases, comorbidities, which puts a heavy toll on our Medicaid and Medicare systems, on our healthcare systems. We also know that people who are smoking, where do they discard their cigarettes? So we're talking about an environmental impact.
Mm-hmm.
We're talking about secondhand smoke. So secondhand smoke, is also harmful. There's there's no safe amount of secondhand smoke that you can inhale. It's classified in the same way as asbestos. So, who wants to be walking down the street and inhaling clouds of secondhand smoke? Exactly, carcinogens. Yeah. So even if you're not a smoker or use tobacco products, this should be important to you, because you want to have a cleaner, safer environment for you and your family.
Right.
You also, it does impact our economy here in the state of New York. So yes, in the billions.
Tell us a little bit about that, Emily. How does it have that broader impact on the economy?
Mainly on health impacts, as Ellen was mentioning. That's I don't know the exact billions, but in terms of the financial burden and the in healthcare and in lost wages due to folks being ill and not being able to work,
right?
Disabilities, all those types of things that result from tobacco use. The cost ends up being in the billions.
And I think when people think about tobacco use, the first thing that probably comes to their mind is lung cancer. But what are some of the other big health impacts from tobacco?
So tobacco causes 16 types of cancer, and it pretty much affects every system in your body in any which way. So it can cause heart disease and complicate chronic conditions like diabetes, make them worse. Actually, the most recent Surgeon General's report links tobacco use to causing diabetes. And so it can also cause stroke, all sorts of respiratory issues that are not lung cancer, such as COPD, emphysema, all sorts of health impacts. So really, any way you cut it, tobacco kills.
Right.
50% of tobacco users will die from the use of tobacco, and that's just the folks who die. It doesn't count all the folks that got sick and survived.
That's an astonishing number. You just gave us 50% of tobacco users end up dying from it?
Yes.
Wow. So, yeah, very sobering. Ezra, let's turn back to some good news. You mentioned one good bit of good news, which was the passage of the Green Code has some new restrictions on where tobacco can be sold. Some other new policy in the city of Buffalo having to do with our parks. Tell us about that.
Absolutely. A few months ago, Roswell, we've been working with Councilmember Pridgen and also Councilmember Wingo and the rest of the council to make it that the parks in Buffalo are now smoke-free. And that was a wonderful action because, like Ellen was explaining, there is no safe exposure to secondhand smoke. And many times we may overlook that. So we want to protect our environment and our community. So that was definitely a very exciting policy change in the city of Buffalo and Western New York.
Yeah.
Yes.
So some of the next steps, we could pass a tobacco 21 law here in Erie County that would say no cigarette sales to people under 21. What types of laws would deal with these point of sale issues? What exactly would we be looking for to change policy when it comes to point of sale?
As far as point of sale, well, one thing that I've learned that is even more interesting is menthol. Menthol cigarettes.
Yeah.
There's a ban, and there has been a push to ban the sale of menthol, which is something that's usually targeting certain populations, especially the African American population. So this is another policy that has been in discussions, and what you find is the menthol flavor, it soothes you whenever you're smoking, compared to other flavors, tobacco flavors.
Right.
And now you don't realize the impact that it's having.
Yeah.
And what we're trying to make communities aware of, especially faith-based communities. It's a faith-based initiative that I've been working on with a few of my other colleagues, is to educate the churches and also the African-American communities of how they're being targeted and manipulated. You know, even how it's being marketed. You know, you see certain celebrities and certain music videos that portray this. So that's something new. And what's even more alarming is that you have national figures that do represent the African-American community or other groups that are receiving donations from the tobacco industry and making the argument to not ban menthol. So, you know, that's something very new that, you know, we have been discussing.
Yeah, so it's really, I mean, it's a civil rights issue, really, when you're talking about people getting targeted by their race for certain kinds of products and certain kind of advertising campaigns and placement of stores in certain areas. It's really a racial justice issue, along with all the health impacts that we've been talking about. One strategy that some places have used is raising local cigarette tax. So we've got a statewide cigarette tax that is pretty high, and you were explaining to me that helps to explain why our statewide rates are actually fairly low compared to other states. But New York City really amped up a local cigarette tax. How did that work for them? Has that been successful?
So what we just heard recently is that they have made it a law that at a minimum you cannot sell cigarettes lower than $13.
$13 a pack in New York City.
Pack, right?
Is
in
the
New York
minimum.
City. So that's the minimum. It's new, so I don't know what the impact is yet, but I'm sure it'll have a large impact. We've seen that we've really seen that cigarette taxes really do help in driving people towards quitting. And when you see statistics, 70% of smokers want to quit. Nicotine is one of the most addictive drugs out there.
Right.
It takes 7 seconds to get into your bloodstream and hit your brain. So that's why, you know, it's very hard to quit, but 70% of people want to quit. And so if they can be motivated to quit, whether it be for, you know, the price of cigarettes, it's getting way too expensive to purchase them, or whatever it might be, you know, our goal is to put as much information out there for people to understand, you know, that they're being targeted by large tobacco companies, and that, you know, there are resources to help them to quit.
Now, for folks out there who want to quit, what works? What works in terms of what's been proven to work in terms of both in terms of sort of the communication and the public education, and then in terms of sort of the actual resources that people use to quit, other than, you know, just going cold turkey by themselves?
So there are resources in New York statewide as well as locally in Buffalo. So Roswell Park houses the New York State Smokers Quit Line, and that is a statewide resource that provides free cessation services to anyone in New York State who wants to quit smoking. So they have trained quit coaches that can help folks plan their quit attempts, really figure out where their triggers are, what they can do instead of smoking, because smoking is a coping mechanism that has been ingrained in both, like Ellen said, the nicotine is very addictive, that releases hormones that cause you to feel pleasure, and so that can give you the illusion that you aren't as stressed out when you're smoking. But we were talking about the health impacts. Actually, your body is in more stress when you're smoking.
Right.
So trying to help folks deal with stress in other ways instead of using tobacco. They can also, the quit coaches can give folks 2 free weeks of nicotine replacement patches if they're eligible. And many people are eligible for that starter kit, and most people need more than that to quit. And in which case, something great that happened this year was expanded Medicaid coverage for cessation medications. So there are 7 FDA-approved cessation medications. Some of those are nicotine replacement therapies, such as the patch, gum or lozenge, that type of medication. And then there are 2 prescription medications, Chantix and Zyban, which is also known as Wellbutrin, that are designed to help folks quit smoking. And so all 7 of those FDA-approved medications are now covered by Medicaid. There are no limits on how often someone can take those medications in any given year. I believe it used to be that they could only try twice, which is very limiting, especially since nicotine is one of the toughest addictions to quit. So they can also use dual therapy, combination therapy. So for folks especially who are smoking a pack or more a day, they might need more than just a patch. So they can use the patch in combination with a shorter acting nicotine replacement therapy like the gum or lozenge.
Yeah.
That previously was not covered by Medicaid. You could only choose one agent.
Yeah.
And what else was covered by the Medicaid expansion? Term
Counseling.
limits, counseling.
Oh, great.
So the
Yeah.
Medicaid coverage is really expanded, which is great for the population that we're talking about, with the low income being
Yeah.
targeted in that.
Now, we've talked a little bit about the tobacco companies who have millions and millions of dollars to spend on advertising and some of the targeting that they do. How about on the other side? What have you found works in terms of tobacco education? And in particular, since they're targeting people of color and people with low incomes, are there particular strategies that have been proven to work especially well with those populations?
So what was your first question? Alan has
Basically, like what works when it comes to doing the public education to both prevent people from smoking in the first place or help them to get to trying to quit.
I would say that, especially in the neighborhoods that we're talking about, the cigarette taxes work. Also, going back to what Ezra said about the menthol.
Yeah.
So 95% of African American teenagers are smoking menthol cigarettes. So that is the highest rate of menthol use is with African American teenagers.
Yeah.
If we pass the Tobacco 21 law, that would help curb that. Also, I've seen studies and heard from folks that if menthol was banned, they wouldn't smoke. And so there you are, saving lives.
Yeah.
So that's something that
Yeah.
could be considered and pushed through.
I've heard it said that you have to make smoking seem really disgusting and gross.
Right.
And I've seen television ads that do that very powerfully so that I have to like turn off the sound and turn my head away. So I'm guessing that those work.
They do. The quit line calls go up a lot when when the state airs those ads, and the state wouldn't spend money on putting those ads out if it didn't work. So it's significantly people use the quit line significantly more when those ads air.
So for all you non-smokers out there who are grossed out by those ads, just remember they're saving lives.
Yes.
So they're well worth doing.
Another thing that I also see that's very positive is at Roswell we have the reality check program that works with youth. We go into the high schools, we work with also middle school age youth as well, and we teach them about tobacco and how they're being targeted.
Yeah.
You know, we have discussions about how you have executives in the tobacco industry mentioning and saying specifically we target the young, the poor, the dumb, and the black, you know, and making sure that they understand that they're targets.
Yeah.
And if we can begin to educate them, teach them how to advocate and work with legislators, how to begin to create tobacco-free communities, we can eliminate the point of sales, you know, how tobacco is being sold, but also we can eliminate youth from smoking and creating new smokers. And if we can eliminate new smokers, then eventually we won't have any more smokers.
Right.
So that's another way that we try to approach eliminating and creating tobacco-free communities.
I really like that strategy because it seems to me that a lot of kids start smoking partly to rebel, because it's anti-authority, and so if you're able to show them that actually the really big, powerful, wealthy authorities are exactly the people who are trying to make them smoke, and so if they want to rebel, it's by not smoking, not by smoking. That seems like powerful messaging to me. Yeah.
Yes, sir. Yes, sir. So very exciting. My experience at Roswell since I've been there has been very enlightening. You know, understanding the issue, and you know, really seeing the progress that is taking place.
Yeah. You mentioned, go ahead.
One more resource I wanted to mention, as I was talking about reality check at Roswell. Roswell has a Just Breathe program, and I just want to mention that is different from the breast cancer awareness Just Breathe program in the community. This is specific to tobacco cessation. And so Roswell initially had this program available to its patients to help them quit smoking, because it can kind of be unique when you have cancer and are trying to quit tobacco, because there's other stressors and things going on in your life. So they wanted to tailor something to that population. But we wanted to open it up to our community because there aren't that many in-person tobacco cessation groups. So we opened it up to the community. So every week there's a tobacco cessation group. It's a 5-week program, but it's ongoing. Mondays from 12 to 1:30 at Roswell. And you can find information about that at roswellpark.org. It's called the Just Breathe program.
Okay, so roswellpark.org, one resource for folks. Is there a phone number that we should be repeating for people as
The
well?
phone number is on the website.
Okay, great. Well, we've just got a couple minutes left. I just wanted to pick up one thread we talked about briefly but didn't get too far into, which was the link of smoking and mental health. And are there policies or programs that you want to highlight or that we should be passing and that we already have that we need to do better when it comes to protecting people with mental health issues from tobacco?
So I would say that we definitely need to do better on protecting those folks. They have the highest rate of smoking out of any population. 36.6% of people suffering with mental health and substance abuse disorders are smoking, and they have they die 25 years younger or before the general population. So their lifespan is on average 25 years shorter than our general population. So there's a huge disparity, and we need to change that. What we've been doing here at Roswell is working with our mental health and substance abuse disorder clinics, educating providers, saying, you should put this in your treatment plan. We've seen studies, and we share those studies with them to say, look, if they're quitting whatever substance abuse, whatever drug of choice they have, quit tobacco at the same time, because they have higher rates of being successful at both than if they quit them at different times, or if one person is an alcoholic or using heroin and isn't a smoker. They actually have lower rates of staying clean than somebody that is smoking and quitting.
That is so interesting, because I think there might be a misunderstanding out there that you should try and do one thing at a time.
Correct.
It must be easier. It's too hard to ask someone.
Or you take everything
You're taking everything away.
Yeah, exactly.
But on average, folks who have a substance abuse or mental health, they're dying from tobacco use. They're not dying from whatever else. It's tobacco that's killing them.
Right.
So we work hard. That's what we do at Roswell. The research that our researchers are doing is excellent. It's, we take that research and bring it out into the community. Yeah,
wonderful. Well, we are running short of time. I want to thank our friends from Roswell Park Cancer Institute. We've been joined today by Ellen Denizard, Emily Facio, and Ezra Scott. Great information from all of you. Good luck in your policy efforts. Ask folks out there to support you in bringing Tobacco 21 to Erie County. 13 counties in New York State already ban tobacco sales to people under 21. Why not Erie County? Seems like something we should really be getting on, as well as some additional regulation on what you've talked about as points of sale, so the advertising, the coupons, the targeting that the tobacco companies and the retailers are doing. Wish you well in all those policy efforts that are helping our community. Want to remind folks out there that this Thursday is Beauty and Democracy at the Albright Knox Art Gallery. It's PPG's 10th anniversary celebration. We'll have music from Drea Denor, dancing from the Differential Flavor Crew, poetry, celebration after the main program. We're doing a reception at the Albright Knox. We'll have some refreshments there, and we'll also be doing a participatory art making activity, so you get a chance to make your own art at the Albright Knox. It's this Thursday at 6 p.m. Everyone's welcome, free and open to the public, and you can get more information about that on our Facebook page at PPG Buffalo. So, with that, I want to thank our guests for being on the program, and wish you the best in all you're doing. Tune in to The Public Good every Tuesday at 7 p.m. here on Power 96.5 FM and Mix 1080 AM.
Everybody over there,
Get on up.
everybody right there,
Get into it.